Welcome to Your Matter Matters, a podcast that explores the questions and curiosities around faith and science. In this podcast, we will not only explore some of the big questions and topics in the conversations between faith and science, but we also embrace the "and" of faith and science. Too often people are presented with an either-or choice. You have to choose science or faith or science. We hope these conversations and explorations will give you permission to not feel pressured to choose one or the other, but rather to embrace the both and to know that you are not alone in pondering and wrestling with these important questions. We believe God made the material world, so therefore God loves matter. God loves science. God loves you and me and your neighbor. We are made of matter, and we matter to God and to one another. Our hope is that you can listen to these conversations and gather with friends and the community of faith that you are a part of. Use this podcast series as a Sunday school class or a small group study group. Discuss together what we talked about and keep the conversation moving forward. That's how we learn and grow. This podcast is brought to you by the Lutheran Alliance for Faith, Science, and Technology, the North Carolina Synod of the Evangelical Lutheran Church in America, and a grant from the North Carolina Synod Michael Peeler and Virginia Casey Fund. Follow us on Instagram and let us know what inspires awe and wonder within you.
You know, it's not just living, it's actually going home. And what does he aspire to do and to be? And can his family, do they have the means to love him like they want to? Most of the time that answer is no with these families because they don't have the money. But that keeps me going for sure.
On today's episode, we explore the questions and curiosity of public health. Our guest today is Dr. Emily Smith, assistant professor in the Department of Emergency Medicine and Surgery at Duke University and at the Duke Global Health Institute. She is also the author of The Science of the Good Samaritan, Thinking Bigger About Loving Our Neighbor.
The science of healthcare. So far, we've discussed evolution, cosmology, AI and technology, the question around pain and suffering, and now a very crucial and important topic, the science of healthcare. And I'll even make the bold statement that along with stargazing and wondering about our place in the universe, healthcare is the OG of the sciences, with early Homo sapiens just trying to take care of ourselves and trying to take care of one another. We've been doing the science of healthcare a very, very long time. And I'm really excited about our guest, someone that I met at a BioLogos conference in Raleigh, who's done work with BioLogos that we've mentioned before here on this podcast. And so, yeah, really excited. Thomas, introduce our guest.
Well, I'm excited for our guest too. When you told me that she said yes, I'm like, oh, this is going to be wonderful. I would like to introduce Dr. Emily Smith, author of The Science of the Good Samaritan, and also author of the popular blog, Your Friendly Neighbor Epidemiologist. Dr. Smith.
Thanks for having me, guys. This is going to be fun.
Yay.
So, Dr. Smith, tell us a bit about your origin story. What led you to where you are now?
Yeah, please call me Emily. Dr. Smith sounds so formal, doesn't it? But thank you for that.
I still sometimes live with a college mind.
Totally. No, one of my favorite professors from undergrad follows my blog, and to this day he keeps saying, "Call me by my first name," and I can't do it. So it's just we are academics. It's what we do. My origin story, gosh, I grew up in a tiny, tiny town in southeastern New Mexico with pump jacks and flat earth that you could see forever. And my parents were lay leaders in our church. They were worship leaders. I grew up in a charismatic church. And our house was always the house where the missionaries would stay when they would be on furlough and come to, when they came to give a talk. And I just remember being enamored by them. I've always been pretty chatty and curious. And so bless their hearts, they were just so kind. And this little 8-9-year-old going, tell me your adventures. And so early on, like kindergarten, what do you want to be when you grow up? I said, I wanted to be a missionary. And Sandy Patty. Do y'all know who Sandy Patty is? She's a Christian singer who's been around for decades. And that didn't work out. It's fine. But I loved the global aspect of life. And I thought the only way to do that was to be a missionary, was to be a doctor. I also loved science, loved DNA in 9th grade, where I read a college book on it. So, total nerd points, but it worked out so far. But I loved science. So I was pre-med in undergrad at a really tiny school in Texas. And I went on my first mission trip to Honduras with the Mercy Ship. And I worked in the kitchen because I couldn't do anything else. But I was able to go and volunteer with the medical teams on off days. And I remember seeing poverty for the first time intertwined with the lack of healthcare access. And I was pre-med, so I thought, well, I'll just, treat one-on-one type of individuals here. But something happened where I noticed that I was asking bigger level questions of not treating one-on-one, but more population level questions of why are these people so poor? Why is healthcare access so bad? And I didn't know it at the time, but that's epidemiology. And I pivoted and got a PhD in epi, and the rest is history.
Mm-hmm. I love that. Was there a moment, you grew up in a charismatic church, but was there resistance of you going into the sciences or skepticism towards that? Because part of this podcast is giving people permission that there can be both. You can be both a person of faith and trust science, and doesn't mean there's not tension between the two at times, but there's a way that, again, we put the and in faith and science in this podcast. So, but was there a time where it clicked for you that they can work together? And did you have pushback in terms of your communities or friends and family?
Yeah, that's a good question. I was really fortunate to never have pushback growing up from parents. I never knew the faith and science debacle was a thing, actually, until my PhD. I've never seen them as distinctly different. I've always seen it as reinforcing. I want to be the best epidemiologist I can because of my faith. And that means that I do my science really well. But I think I've always viewed it from the story of the Good Samaritan. So I didn't know there was pushback nearly as much as there is actually until the pandemic.
Right.
Yeah.
Well, that's actually something interesting that word reinforce, I don't think has ever come up in our previous podcasts. I think that's it's always been faith and science and conversation. They're working together, but I could be wrong, but I've never heard it framed that way, that faith as reinforcing science and science reinforcing faith. So Emily, thank you for actually adding new language to that conversation.
Yeah.
I love that.
I think, it feels, people ask me all the time, how do you do both faith and science? And I don't think I know how to not do both, because the Venn diagrams of both of those living out in my life are almost completely overlapping, if not just one big bubble. And to me, it's the beauty of the story of the Good Samaritan. I remember my first week of getting my master's in epidemiology. And my professor said, epidemiology is the science of the determinants and distribution of a disease. So what makes it spread and who is at risk? And he then said his definition of it is a health equity issue of nearly all the time. The people that are most at risk are on the margins always. And epidemiology is the science of finding who they are and choosing to do something about it. And it just clicked. And that's the story of the Good Samaritan. It's finding the groups of people who are on the side of the road of poverty or lack of healthcare access. Most of the time it's both, and choosing not to walk by. And so when I say I feel like it's reinforcing or one big diagram, me doing my work the best that I can means I identify them. And then faith helps me take a step to actually stop and do something.
I love that. And thank you for defining epidemiology too, because we've talked about how defining terms, being clear what we mean by the terms that we use is important when you're having these conversations. And even when someone asks me, do you believe in God? I'm like, well, what do you mean by God? Or do you believe in the Bible? What do you mean by Bible? Those kinds of things. So even these scientific terms can be overwhelming for folks like, oh, I got to go Google and look that up and study it and get a PhD in this to understand it. But you explained it really, really well. There. And so I appreciate that.
Emily, I want to go to your book then, The Science of the Good Samaritan, thinking bigger about loving our neighbors, because I love the way you frame your book, centering cost and courage. When you were writing this book, and when the origin of this book were being developed, what led you to frame your book in those 3 ways?
Yeah, what a great question. Well, I think the 3 C's are because I'm a good pastor's wife. I've been a pastor's wife for nearly 23 years now. And with all good sermons, you need a good, something for people to remember, the 3 C's. So I think that part just came naturally. If you notice in the book, the majority of it is spent on that centering part. And, during the pandemic, I started a social media page called the Friendly Neighbor Epidemiologist. This is early March 2020. In January, if you back up a few months, when a lot of us epidemiologists and public health people were hearing rumblings of something in Wuhan, we knew exactly what that was. I mean, we were trained to notice outbreaks and also project what they will look like. So when we started noticing what was happening in Wuhan and how it looked like it was being spread airborne, we stood up. It was very different than Ebola, where it's an awful disease. But when someone's sick with Ebola, it looks like with this new disease, which was COVID, it was sneakier and you couldn't quite tell. So we were paying attention to it. We all remember March 2020. And I tend to be overly helpful and overly chatty. I mean, I'm sorry if I sit beside you on an airplane. So I just named a Facebook page, Friendly, because of that. And then Neighbor, because something that was like COVID was going to take us neighboring one another. My day job is at Duke as a global health epidemiologist for children in really, really poor countries trying to reach cancer and surgical care. Those communities, and here in the U.S., those communities with lack of funds or access to care insurance, they are always going to be the ones that are hurt the most from these type of outbreaks. So I named it Neighbor because of that. So Friendly Neighbor Epidemiologist. You fast forward about 15 months and it had grown to hit about 10 million people in 160 countries, which had I known, I don't think I would have done it, because I don't think I knew I had the courage in me to do it, which is the last part of the book. But the centering part is what struck me so much, because centering like a good neighbor through the Good Samaritan story it's more than just giving food to a food pantry and donating to wherever we donate, which are all good and holy things. But in the Good Samaritan story, we see the man stop on the side of the road, bandage up the acute care needs of the person who was hurt, and then, and this part always makes me teary, takes the person to a place to recover and then pays for all of it. There's an extravagance of neighboring through the story that is a both and. It is food pantry and how do we live the rest of our lives? And that is more than just being a good person. That is a centered heart on something more that just made that man stop on the side of the road. That's what I wanted to impart to people, that centering is a lot of hard inward work. It takes dismantling unconscious bias that many of us probably have, and we don't know. It's reckoning with that and saying we need to do something. It's also hearing stories of other people and lived experiences. And so I spent a lot of time doing more of the heart work instead of a checklist of this is how you're a good neighbor.
Nice.
And Emily, that's what I made this note. I really appreciate the distinction you had at the beginning of your book of the difference between being and doing.
Yeah.
I really appreciated that distinction. And this actually, Will, this next comment is going to tie us into our cosmology conversation.
Mm-hmm.
But the fact that we're products of ring, that we are connected.
Yeah. Yeah, that entanglement, or that we're all connected to each other, really was clearly revealed in the pandemic about my actions, where I am, even my proximity to you makes a difference in terms of somebody's health. And a lot of these questions we've wrestled with faith and science, or had discussions about, has its tension between like how we interpret scripture and then what science is revealing about the universe as a whole. But what your book does, it really blends together scripture and how we take care of our neighbor, which is what healthcare is. And really your Facebook page went, don't know this pun so bad, went viral during the pandemic, because we were watching science unfold in real time. People who didn't understand how science works and how you discover and how you pivot and how you learn were like, I don't know who to trust. I don't know what to do. They're saying one thing, they're doing another. But your Facebook page, and then now your Substack, helps people understand and articulate what the process is and going on. Maybe share a little bit. I mean, the questions and the tension around healthcare, you felt you had some backlash, or people really lashed out because people do weird things when they're scared and nervous, and they were scared and nervous during this pandemic. And so you probably felt a brunt of that. Tell us some of that, how you navigated that, and then how do you and your profession continue to articulate the science of healthcare for our neighbors?
Mm-hmm. Yeah. And I think it goes back to the question, or the point that Thomas just made about the being versus doing, because the Good Samaritan story, if you look at why Jesus even told the story, a man came up to him and said, "Who is my neighbor?" And he was trying to trip him up. And to me, that's a question of what's good enough to be good enough. Just give me a checklist. I'm fine. Jesus tells the story, and then he turns to the man and he said, "Now, who was the neighbor?" It is so hard for people to do the doing versus just give me a checklist and let me live my life. And so through the Facebook page and during COVID, what I was asking people to do is to recognize the doing part. It's going to be inconvenient. We love our neighbors. A lot of us who maybe have insurance and a good nest egg and weren't employees that just had to go to work, there was some protection there. And what I was asking people to do is do the best you can not to get sick and to spread it, to protect those that have not the choices that we do, basically, or they don't have a nest egg, or if they go to the emergency department because of COVID, their entire life savings is wiped out. That we were in Texas at the time. We were kind of in the belly of Texas, the buckle of the Bible Belt. My husband was a pastor at a really large church, an evangelical church. And once I started saying, we can actually show our faith more by wearing a mask and getting a vaccine. That's when, and everybody saw this. You saw it on the news where people were saying, actually, that's a sign of fear. And I was going, wait a minute. Galatians 5 says, no, we're going to take care of one another. Jesus actually said the second commandment, almost as important as love the Lord your God, is love your neighbor. And so I just could not understand the distinction. And I kept speaking out about it. When everything got kind of loud in the U.S. about vaccines and COVID and how it was interlaced terribly with faith, we started getting some pushback. We, as both my husband and I think part of the pivot point for me, or for me to realize this is bigger than what I anticipated, is we had some threats at the house. And, we were all at home. My kids were there. And it is another level of fear. It's one thing for people to threaten with guns online, which they had been doing. Then when they come to your house, it's almost another level of when you know some of them. You go to church with some of them. And so it was incredibly unsteady. For me, both of us are pretty peacemaker type people. So sure. I just was not trained. I'm not aggressive by nature. I wasn't trained to deal with that. but it just kept going. And, there was a little bit of a conversation of, do we keep going? Because there were, I don't go into detail just in the book, nor really in talking about it too much, because I don't want to bring a lot on, but some of it was against the kids at their school. So we pulled the kids from school. I mean, there's some real repercussions of speaking out like a neighbor, and they continue now, especially because I kept the Substack blog up. So if you notice in the book, there are 2 chapters on cost that I wanted to tell people: when you act like a neighbor in today's world, that is set up, a world that's set up to do the opposite of neighboring, there could be a cost to it. And I want you to be ready for that, to have some strength, some wisdom to be able to handle it a little better than I did. The last part of the book is on courage and on how to do that with wisdom, but also stand up.
Wow. And Emily, thank you for sharing that. I remember when I was in Texas, I had a colleague who preached on the cross, but we carried the cross when Jesus says, take up your cross. It's not just take up the cross for yourself. It's take up the cross for your neighbor.
Yeah.
And there's a cost for taking up the cross for your neighbor. One of the things I highlight in my sermons is like, yeah, there is a cost to being a Christian. You're not going to look like the rest of the world.
Right.
And that's exactly what Jesus calls us to do. That's what it means to be a neighbor.
Right.
Yeah. We often think that that's like individual. That's just me with my own cross or my own salvation. But with healthcare and in community, your sermons, talking about we do this together. And so that discernment of who is my neighbor is not just me deciding on my own and my own, enlightenment of who my neighbor is, but I do that with another person, with the community, and we discern together who our neighbor is, and then how we take care of each other and our neighbors beyond our walls. And I think that's a powerful story. It's interesting to me hearing your story that growing up in your faith community never had pushback when it came to faith and science, or how you live out your vocation and how you live out your faith as a scientist. But it was later on to pandemic. That's when it kind of came to a head with folks resisting about, hey, wait a minute. What do you mean? Yeah, I'm scared. I'm nervous. Fear versus, freedom, or whatever that means in terms of taking care of our neighbor. That's where it showed up. That tension between faith and science came to a head there.
During the pandemic and also pre-pandemic, post ending of the pandemic, I'm not sure if we're kind of there yet.
Yeah.
What are the conversations like with your fellow doctors in terms of the relation between faith and science?
Good question.
Is it very are there some who are very, well, this is science, others kind of lean more in the faith? Or are there others like you who find that one reinforces the other?
I think so, but I think we are trained in school to keep them very distinct. And it wasn't until the pandemic that people probably knew that I was one or the other. Like, church people didn't know that I was a PhD scientist. And then my science friends didn't know my husband was a pastor. Some of them did, but I certainly didn't wear that. And then everybody knows all of it now. And so I've just kind of leaned into it to not be a mean Christian, and I put Christian in air quotes there, or one who is about a co-opted, like a capitalist definition of freedom that is not Jesus' freedom. And so it has opened up a lot of opportunities to actually talk about what I'm motivated by. And it's okay if not everybody else is motivated by it, but I am. And, I think maybe for some that are faith and scientists, it's given them courage to be able to do the same, but again, not be the mean kind, like the power grabber kind, the Christian nationalist kind, but we're going to love our neighbors in a very quiet and real way. For the doctors that I talk to who are not people of faith at all, man, it's been some incredible conversations about, I view faith as such a beautiful way of service. And I actually think that is the core of who Jesus is. And if you live in America, sometimes it is hard to see that being displayed by Christians who are really loud, the Christian nationalism group again.
Yeah.
And so I think it can help, redefine what faith is for them.
Mm-hmm.
Yeah, I love that. It's like not only can you be a person of faith and a scientist, but perhaps you can also be a Christian and not be a jerk. That's
Totally.
another thing that maybe
yes.
and that's part of this too is how we model, together, how to have healthy conversations, but also to do it in a way that is humble and intellectual humility and all those things. We talked about the difference between science and scientism and having all the right answers or feel like you know all things, but there's a kind of intellectual humility that goes into hopefully both faith and science when you're trying to think through the big questions and what we're wrestling with. And again, like I love it that like you're living your life and certain things come up in conversations as you get to know people, who you are and what you do and what your vocation is. And people share with me all the time, know that I do a lot of faith and science work here in the Triangle, here in Chapel Hill, across the street from UNC, near Duke. Have a member of my church who's an astrophysicist and a particle physicist who works at CERN. And they're like, well, Will, that's easy for you to have these conversations with these scientists who have PhDs, but I'm like, well, you know what? I guarantee you in your congregation, in your community, you have a dentist, you have a chemistry high school teacher,
right.
You have somebody who's an engineer who's working with math and science or an epidemiologist or a doctor who works, a pediatrician down the road that are in your community who are still working with the scientific method, who are still working in the sciences. And a lot of it has to do with healthcare. So they're right there beside you. So you can have these conversations with one another about how they live and learn and what sparks curiosity and care for them in the world.
Right.
I think it's important. Yeah. Yeah.
Yeah. And I think the Good Samaritan story is one of the best segues for people to have those conversations because it's just about service. And regardless if you're an astrophysicist or a dentist or an epidemiologist, I mean, it can infuse, we're all serving for something or we should be. So I think if you are, you can use that story as a means in. It's also interesting because at the beginning of my book, I put where you can see the sentiment of the Good Samaritan story in all of the world's major religions. And so it's a good conversation starter for people of other religions too. It's almost like we can all center on this issue and no one has to win. I mean, there's not a winner. There's just service.
Yeah.
The zero sum game mentality is very, no pun intended here, but baked into our DNA. And there always has to be a winner.
Yeah.
And whatever we do. It's speaking of public health care, Emily, how do you get your information? How do you get your statistics, your stories, your data? How do you get all of that, given that public institutions who normally provide said data, their funding has been cut?
Yeah.
Some of the websites have gone dark. Research institutions have had their funding cut, especially the ones that are leading the nation in clinical trials for different drugs and medicines, and also proactive research. How do you do your fact finding?
Yeah, that's such, especially right now. I mean, it used to be a lot easier when you could trust the websites where it's their job that to track these outbreaks. Now you have to do some hunting. There are trusted messengers that are like me that they have a team of people who go to the state databases to try to track, for example, flu. When we had the government shut down, that you would just have to go state by state to find this information. But you have to, it's hard for the public. I have so much empathy for the public because to find those people that you don't know from Adam, and then you have to just trust them. There's a lot of noise online right now. And so I understand that. I would definitely just find people that you trust. I have a good network of about 12 scientists just like me who are also influencers. And, we all have our science communication. And so I would recommend any of them to follow, but be really judicious in who you listen to right now.
Yeah. I think there is a kind of an undermining of truth, and then there's mistrust, and it seems in our present day and post-pandemic, in the wake of that, some of the fallout has been distrust in kind of institutions, and then people trying to co-opt legit science. So I think it's a really good question of like, who do you vet as someone who you trust in terms of getting your sciences, the data information. So any other helpful hints? I mean, I guess following your Substack, and then you recommend people through that to listen to and things. So for people who are listening to this, follow Emily. Make sure you not just a Facebook article that is passed from your great uncle because they read one meme and now they're convinced, but do some vetting when it comes to those things.
I would also look at the posture. In my book, I talk a lot about the witness, WITH-ness instead of witness. And there's a posture of what's called accompaniment. And Dr. Paul Farmer,
yes.
and then some of his priests in Peru, Gutierrez, he actually talked about this posture of accompaniment. And it's walking with people, not in front of, not behind, not pushing, not really far away, but you're actually with them. And to me, it sounds like the story of we take off our shoes because the ground is holy around us. And I see that the most in helping. And I think that you can smell out people who have a posture of humility and a posture of witness, taking off shoes because someone is accompanying these communities. There is some wisdom there in discerning that versus voices who are clickbaity, who are othering one another's. If you see that, I would just call a spade and not follow or trust that. So there's wisdom for sure.
I love the word accompaniment. The ELCA uses that a lot in terms of we have a program called Young Adults in Global Mission who are sent overseas or to another country, not necessarily as missionaries to convert everybody, but to accompany people where they are and to learn, to serve and to grow and to walk with as their own witness, but also as a Christian witness. And it's really, really helpful word. And also I want to share, part of our experience here at Holy Trinity in Chapel Hill during the pandemic was this accompaniment. So often we hear the bad news or the bad apples or the clickbait of those who handled the pandemic in an unhealthy way or resistant way. But the good news of what we did on Franklin Street and other area churches, I think needs to get out there. At the beginning of the pandemic, ministers on Franklin Street, the big churches on Franklin Street, we were like, we met once a month for lunch just to check in with each other. But when the pandemic broke out, we're like, we need to meet together. What are we doing? How are we taking care of each other? And so we're meeting once a month on a Zoom, or once a week on a Zoom, on Monday morning. How are we doing this? Doesn't mean we have to do everything the same, but how are we taking care of our communities? And can we be of one voice in mind in how we take care of our neighbor? And then from University Methodist, Dr. Wes Wallace, the director of emergency medicine at UNC, became our consultant, our weekly consultant, where we gathered and sat at his feet on a Zoom and said, all right, what's going on with this virus? What do we see? How are the hospitals doing? What are those numbers? How can we take care of our neighbors? What did we learn about this virus and how it's spread to one another? What does it look like? How far are we away from these vaccines? What are the effectiveness of these vaccines? And who should get the vaccines first in our marginalized or immune compromised community neighbors? And so to see that unfold and us having these conversations doesn't mean we weren't scared, doesn't mean we did everything perfectly, but coming together as sometimes the Zoom had 40 clergy on it, listening to Dr. Wallace and saying, tell us, how are the hospitals? It was just a beautiful thing that unfolded. And then our relationships even grew tighter post-pandemic, that we were like, all right, now when the Black Lives Matter movement in the wake of George Floyd's murder, how do we pull together for that? How do we stand up for justice? Later on down the road, how are we taking care of the marginalized? How are we taking care of our communities? And it really was a beautiful thing. I know there's a lot of churches who did some really horrific things or really undermined what was being said out there in science. But there's a good story there about here on Franklin Street, some churches that pulled together and listened to Dr. Wallace. I tried to get him on this pod today, but he had something else going on. We'll talk to him another time. But what a humble guy and a great guy. And I couldn't be more grateful for what he did for us and what continues to do for us. And then for you as well, like in terms of putting yourself out there there's a cost and there's courage that you embraced to say, hey, this is how I take care of my neighbor. And I think that's why this topic is important. Yeah, we love the evolution talk and the cosmology talk and the AI and tech. Those are important faith and science conversations. But here in the kind of our top 5 questions we wanted to address in this particular series, maybe there's a season 2, I don't know. But in season 1 and this one, I thought healthcare was really important to talk about because of how science itself now is being undercut or undermined in a lot of areas in our current administration. Yeah.
Yeah, and I think everybody has a vantage point for this, and you don't have to be a scientist to be a good neighbor. Moms and dads making decisions to raise little neighbors of the future. What a glorious, I just can't imagine. I remember with my kids, and I put some of these in the back of the book in an appendix for moms.
Yeah,
just asking, I've got 2 kiddos. I cannot go to Africa. Well, then get a map and put it on the fridge. And when they talk about an elephant, go to Google Earth and let's go to Botswana, and just putting neighboring in their little hearts where there isn't an either or is powerful. But I also think, as we do what we do well, I love the story of what you said during the pandemic with the churches and standing up. And, in our community just this week, we have ICE here. And I'm going to my kids' school and we're standing there and doing what we can. I'm just a mom, but I can stand there, or raise my kids to know, wait a minute, what is happening is not right. But I also want to push people to think population-wide too. One of the most powerful stories in the book that I still get the most reaction, good and bad, from is during the Ebola epidemic that happened in the early 2010s in East or West Africa, Sierra Leone and Liberia. And it just whammied that healthcare system. When Ebola hits, it hits really quick because it is so incredibly contagious. But it is not deadly. I think there's a misconception that Ebola is super deadly. Right. It's not, unless you're in a place that doesn't have supportive care like East Africa, West Africa. And so when Ebola hit, there is a doctor named Dr. Khan. In the continent of Africa, he would have been a Dr. Fauci. He was a Dr. Fauci. People knew who he was. He actually came to the States with Dr. Paul Farmer, who's a global health legend for those of us in science. And they went to Congress and said, if something like Ebola or COVID happens at my hospital, this is Dr. Khan talking about his in Sierra Leone, we are not equipped for that. So we need X, Y, and Z to get, to be equipped. And there was a couple of patchwork items that were given, a building, but it was just Band-Aids. And so when Ebola actually hit his hospital, it just ran through it. One of the people to get sick was Dr. Khan. And with Ebola, if you don't have supportive care, you go down very quick within days. And so a decision was made to transfer him to a facility that a Doctors Without Borders facility that could take care of him a little bit more than where he was. And again, he got sicker and sicker. At the time, there was what's called ZMapp, which is it's an experimental drug. It is now not experimental, but at the time it was. There were only a couple of vials in the world for that. And it's almost a Hail Mary for someone who has Ebola. This is the last thing we can do. So a decision was made, or was talked about being made, of do we give it to Dr. Khan? Now, we don't have time to go through, I'm sure, the conversations. Can you imagine? I can't either. I talk about it in the book, and New York Times did a really great article, but at the end of the day, he was not given the vaccine or the treatment, and he passed away without his family. The only person let in at the end was a friend. In a neighboring country, around a 1 to 2 weeks of the same time Dr. Khan got sick, another doctor and a nurse got sick with Ebola. Same thing, went down real quick. They had to make a decision there of, do we give them ZMapp? And not only that, do we give them transportation like a medevac back to the U.S.? It was asked for Dr. Khan to get a medevac as well, but they wouldn't take him because he was so sick. The decision was made for those other two, the physician and the nurse, to give them ZMapp. They were also brought back to the U.S. to one of the NIH treatment centers. And a couple of weeks after being here and treated, they walked out of the hospital alive. Those two individuals were American. They worked for a very well-known organization here in the U.S. And the chapter ends with trying to get people not to ask, well, who should get it? I think that's the wrong question, because, I mean, if it was my family or your family, I am moving heaven and earth to get them here for treatment. But that is also Dr. Khan's family would ask the same question. I think the question as a global population level epidemiologist or just neighbor is, why wasn't there enough ZMapp for everybody?
Right.
Why are the systems not in place in West Africa that are here? In the COVID pandemic, high-income countries gobbled up 80 to 90% of the world's stockpile of vaccines and oxygen supply. And so when it hit India, it whammied India because the country literally ran out of oxygen. The question as a neighbor that I see is, why wasn't there oxygen there in the first place? That shakes our systems. That shakes our individuality or our America first freedom type of mentalities to, if Jesus and God loves the whole world and died for the whole world, what we can do is educate ourselves on where systems are unequal and try to not walk by that as well. So, and a lot of people can't do that. I do policy work where I can have those conversations and advocate at the United Nations for universal health care for all children. But a lot of people can't, and that's okay. But I think part of centering our hearts, like a Good Samaritan or a story, or a Good Samaritan is hearing these type of stories and then letting it seep in our hearts and challenge some of our misconceptions, maybe of capitalism, maybe of individuality, and act like a good neighbor that way too.
Wow. Beautifully said. And that's what I love about your book as well, that I encourage people to read. It's not steeped in hard science that you have to understand all things, like hard scientific equations, but it shares a story similar to what Jesus did. People ask him a question, he goes, let me tell you your story. And that had the impact. And so your book does the same. I'm curious, as we in your work, coming in the wake of COVID and other things, how are we doing out there in the world? Is there another pandemic brewing out there? Are we okay right now? I'm nervous because of what's been undermined and grants cut and research cut and undermined. Makes me a little nervous that we'll be ready next time. I think with COVID, the reason, tell me if this is right or not, the reason the vaccines got out so quick were not because of some conspiracy, but because they were already working on different strands of COVID, and they had already done a lot of work and a lot of research, a lot of money been poured into, if a pandemic happens, we'll be ready. And so how are we doing out there? Is there anything we need to keep our eye on or watch or see what's coming down the road, whether it's a year or 50 years or 100 years from now?
Well, I wish I could say I'm not nervous, but I'm nervous too. The world came together with COVID. And then afterwards, when things had settled down, they came together to say these exact questions. What do we do in the event of a next one? Lessons learned and what can be done. And they signed a COVID accord, a pact. One of the countries to not sign it was the U.S., which we have been a predominant funder of the WHO and UNICEF. I mean, these just helping children reach food. And so when that is pulled out, it has real world, not only repercussions for the individuals, but also ripple effects for other countries pulling some of their giving as well. So one of the systems that have gone down is our surveillance systems here in the US and globally. It looks, if we just look at the US, it looks like this flu season, it could be really bad H3N2 is what's showing up in the countries who typically have an earlier flu season than us. And it is just hitting them hard.
Wow.
Our surveillance system, though, has been defunded nearly entirely, including some of the grants to figure this out. So I am worried about that. I think we might get caught on by surprise. If you haven't gotten your flu shot, now's a great time to go get that in COVID.
Yeah.
Globally, I am very worried about what's to come, because what we used to have was, if, like for Ebola, for instance, or actually, let's talk about Marburg. Marburg is in Ethiopia right now. When you have a suspected case of something like that or hemorrhagic fever, those reporting systems go from one hospital to the next, to the country, to the continent, and then to the WHO. What happens then is an alert is sent to other countries of suspected cases. Be on alert. Just such good neighboring. Those have been incredibly disrupted right now.
Yeah.
So I'm very nervous about that. If you think of something as simple as feeding children or taking care of vaccination programs, these long-standing programs that have been equally funded from multiple countries, those have been defunded as well. And so it's really hard to find where the populations of kids, like in the Sudan or Gaza, when there's need for food to get there, we want to do this before a famine hits so that we're ready. The systems are not really in place right now to find those alarm systems. And so what's happening in the Sudan is famine is now becoming historic over and over again because we weren't there in time. Lots of other political reasons for the Sudan specifically, but it's a good, a sad story, I think, of what's to come. My work, I thought was going to be defunded. I have an NIH fund, and we will see if it gets refunded next year. I don't know. I made it through this year, so my little team in Tanzania can keep happening. But the on-the-ground repercussions of that are the children who are trying to get to their cancer and chemo care. What my job does is trying to help them get to care just by paying a bus fare. These families can afford that, and that's life and death to these kids. So and that's just one project. When one of these are defunded, children are just going to die, and they have been dying.
Yeah. And again, that image, the parabolic image of, are we going to walk on by and not ignore, not my problem, or bend down to help others, I think is a big part of your story and our story. And yeah, it makes me nervous. It's not that, it's like, well, I don't like the information. I like the stats. That doesn't make me look good. So I'm going to just ignore it or undermine it or say it's not true. But that's what worries me in these conversations. Like, I just don't like that information. I don't like the answer to that math equation. So I'm just going to change the whole equation itself. It's like, no, these are important. Right. So I think it's important for us to listen to people like you and doctors like you who are doing this work, and to be really attentive, because as we've said, we are a part of one another, entangled with one another, connected with one another. And what I do, my gravitational pull affects yours and all that. So again, thank you for your work and your courage, and keep at it. One of the things we've talked about on the podcast is the common ground between faith and science is often wonder and awe and curiosity. And so you shared a little bit about your story of your wonder and awe and curiosity of the world and missionaries, but then also science and where that's evolved to where you are today. What keeps you doing what you do? Is there anything now that sparks wonder and curiosity and awe in you on a Wednesday morning, podcasting with us, but then what's going to keep you going tomorrow?
Well, thank you for making the distinction on curiosity being a key tenet of faith and science, because it's curiosity and awe dismantles judgment and othering, probably more than anything else, of just asking why, and that makes you stop and then not walk by. I think for me, I was just at the study site in Africa. It's at the base of Mount Kilimanjaro. I mean, you see the mountain when you walk from the house to get to the hospital. It's just it's as dreamy as what it sounds. But when you get there, there's a lot of children there who have come for cancer care and they've made it too late because their parents couldn't afford food just to get to that bus fare. One of the kids, though, that I saw, he came in with stage 4 kidney cancer, and his belly was distended. Just like a little basketball there. But we had if they can make it to the hospital, their chemo treatments are free. And so they don't have to worry about that. But most of them live too far away that they have to live at the hospital with their families, which moms and dads are going to do that. We all would do it. So he got the chemo. He then was able to get the surgery to take out his tumor. And he was on his little belly coloring a book when I first went in there. And he flipped over because he wanted to show me his belly. And he just kind of held it to show me it's just flat. And he was about to go home. Awe and wonder. He will go home to a pretty remote place, to a very poor family on the brink of poverty. So there is still work to do to not go by, but he is living and he's going home with his grandma. Those little sparks of neighboring and seeing kiddos like him just live a life that God destined them to do, to be able to flourish, it's not just living, it's actually going home. And what does he aspire to do and to be? And can his family, do they have the means to love him like they want to? Most of the time that answer is no, with these families, because they don't have the money. But that keeps me going for sure. Also, I think the pandemic, if anything, what it did is it showed me that I have some courage in me that I didn't know I had. And I tell people all the time, and this makes me a little teary, if you are a peacemaker, if you are more quiet and introverted, just like I am, definitely not an aggressive person, but you get into a place where you are called to step into something more than what think you can do, and you come out of the other side and you've done it. That is God. That took faith, but it also took you saying, I'll try it and see. So I would just encourage people. I think you have neighboring in you more than what you might think you even have, and just try it and see what God does. Also use wisdom there. I tell the story of Nehemiah in the book. It's one of my favorite stories, where he goes back and rebuilds the wall. And these two naysayers, Sanballat and Tobias, come up and try to distract him. And he says a beautiful, I have it on Post-it notes all over everywhere, but he says, I'm doing a good work and I'm not coming down. He remained focused on what he needed to remain focused on and didn't let other people distract him. I think that's what gives me courage too, to keep going, is I have pretty good barriers and boundaries on who I listen to, and conversations I just leave. If it's not going to do good for my heart, and if it's going to distract me from doing the work in Africa, I leave. And a way for me to figure out if I have listened to the Sanballat and Tobiases is if I am washing my dishes and I'm so mad. You read something on Facebook, or you see something, or you hear a conversation from a friend at the Thanksgiving table, and it just takes your goat for hours. That it probably is an indication of, okay, I have lost focus here, and I need to remember what my great work is to not come down for. It keeps me going.
It's beautiful and wise. Yeah, I tell people the story of when I was in seminary. There were definitely some retired ministers who had pastored churches during the Second World War. And I just looked at them with awe. It's like, man, I'm such a wimp. What they had to navigate during the World War. How did you do it? Like, how did you get through it? You're half your congregation left to go fight in the war, and most of them didn't come back. What did you do? And they just kind of looked and said, we did what we had to do. We stepped up and did what we had to do. And so I imagine myself being a retired minister, and one day a young seminarian will come to me like, how'd you survive the 2020s?
Yeah, that's right.
And I'm going to be like, I don't know. We just did what we had to do. We found ways to love our neighbor and take care of ourselves and sort it out. And we did it together. And, I found some things in me that I didn't know I had, some gifts I had that I didn't know I had. And you just kept going, and you leaned into your faith, and you leaned into truth and the hope that we are taking care of one another and growing how we love God and love our neighbor is a part of that. So,
and
man.
don't forget the God that walks by too. Walks not in the good, like the story of Moses, when Moses said, "Let me see your face," and he put him tenderly in that cleft of the rock, and he could have said anything when he walked by, but he declared, "The Lord is gracious and compassionate, and slow to anger and rich in love." Like that is remembering and leaning into the safety of that, I think, can give us courage too. So don't forget God either. To people of, it's easy when we get busy in neighboring. Sometimes I can, but
Absolutely.
to lean into his character reinforces that in us too.
Beautiful. Thank you so much for being a part of this podcast, Emily. I will keep following your work and reading your Substack. So yes, find this book. Thomas did at a bookstore way up where The Science of the Good Samaritan, Thinking Bigger About Loving Our Neighbors, Friendly Neighbor.
Yep.
Substack, epidemiologist. Right. And then Dr. Smith has been also on BioLogos, a great resource we've said is in terms of the conversation of faith and science. She's been on a handful of episodes over there on their podcast over there, The Language of God. So check her out. Anything else you want to plug or recommend that we look towards as we wrap this up, Emily?
No, thank you for having me. And I just hope people feel encouraged and buoyed a little bit. It's a hard world out there, but what a joy to be able to be neighbors in it.
That's right. That's good. Well, Thomas had to bounce and go lead a chapel. So what we normally do is, and you're going to do this with me, Emily, on the count of 3, I'll say 1, 2, 3, and then I'll say, and remember, and we'll say together, your matter matters. So we're going to, even if we don't say it in sync perfectly, that's okay, just to share that we're human. So, all right, here we go. So always remember, your matter matters. Yeah, there we go. We nailed it. Thanks, y'all. Peace.